Welcome to Everyday Nursing Knowledge Lectures, and today we will learn about intracranial pressure or ICP. What is intracranial pressure or ICP? It's the pressure within the skull and it's on the brain tissue. And what contributes to this intracranial pressure? It is caused by brain tissue itself, the blood flow to the brain, and cerebrospinal fluid. It's a fluid that protects the brain and the spinal cord. So remember, in any of these factors, if the volume increases, example in brain tissue, if there is a large tumor, or if there is cerebral edema, or if there is an hemorrhagic stroke, or if there is a block in the CSF pathway, the patient is at risk of increased intracranial pressure because the volume increases and the brain is enclosed within the skull. There is no space to expand. As a result, the pressure within the brain increases. What is a normal ICP? Normal ICP is 5 to 15 mmHg or less than 15 mmHg. That means if a patient is on continuous ICP monitor or continuous ICP reading and you see a pressure of 2, no intervention needed. But if pressure goes above 15, keep monitoring, and if the pressure reaches 20 and sustains about 20, it is a medical emergency. The reason is as ICP increases, remember blood flow, the pressure within the brain increases. So blood flow to the brain decreases. As a result, brain is deprived of blood and oxygen. That can lead to permanent brain damage, so it needs immediate treatment. Now, how do you monitor continuous ICP? There are 3 types of continuous ICP monitor, that is external ventricular drain EVD or the Bol system. In external ventricular drain, a catheter is inserted into the ventricle. Ventricles are fluid-filled space within the brain and it's filled with cerebrospinal fluid, CSF. The advantage of EVD is you can measure the ICP as well as to drain the CSF. So a catheter inserted into the ventricle that is filled with CSF. It's a gold standard intervention for raised ICP because as it goes up, you can drain CSF and decrease the intracranial pressure. Now in bolt system, there are subarachnoid bolt, epidural bolt. In subarachnoid bolt, you can see the picture. A screw is inserted through a hole drilled in the skull and is placed in the subarachnoid space. There are sensors which senses or records the intracranial pressure from the subarachnoid space. In epidural bolt, again a hole is drilled into the skull and a sensor is placed to the epidural space, and the sensor detects the intracranial pressure. The difference between external ventricular drain and the Bol system is in EVD you can measure ICP as well as drain CSF, whereas in Bol system you will be able to record or measure only intracranial pressure. So today we learned about intracranial pressure, and thanks for watching my video.